Hi, everybody. This is Expect More with Dr. Andrea. And today our guest is Mrs. We just went over this. Erin Cearfoss Hallian, athletic trainer at Northern Burlington High School, and a very good friend and longtime supporter of me on my personal career and my journey. And she represents all that we could ask for in athletic training. And I'm just so excited to talk to her. So, Erin, can you tell us, Miss C, please, your background, kind of how you got into this and what you do?
Yeah. Good morning. Thank you so much for having me. I'm pretty excited and humbled. I have been an athletic trainer for 25 years, and I really kind of
You look like a
fell into it by
baby.
accident. Yeah. Thank you. Uh,
25 years. That's awesome.
25 years. Yeah. I fell into it by accident. We did not have an athletic trainer at my high school. I had no idea what the job was. My dream was to be a teacher. And when I started looking at schools, one of the universities I looked at had a dual education program in both sports medicine and teaching. And I was completely intrigued because I love sports, even though I'm not a good athlete. And I thought that was a good fit. And then I went to the campus and I fell in love with the campus. And then after graduation, I dropped the education portion and
All
moved
in.
solidly into athletic training.
How long
So
how long
here I
did it
am.
take you? How long were you in school for?
My bachelor's degree was 4 years,
Okay.
and then I started my master's degree as a full-time employee in athletic training.
Okay.
So
Yeah, so I mean, a lot of people don't understand that. I think also it's a misconception that it's a pretty cush gig for the most part, because I think people perceive, right, that you get teachers benefits sometimes, sometimes some locations
yeah,
depending on the district, but
sure.
um, it's legit work. And I myself spent 2 years in interning in an athletic training department, which is how we met. And it
Yeah.
was eye opening for me. And it's one of the professions I have so much respect for. So, coming out of school, was it what you thought it would be when you started working?
My first job was at a Division II university,
Okay.
and it was much different than what I expected.
Okay.
It was much more difficult to really, uh, I would say, build relationships with our
Okay.
patients. Uh,
Sure.
the overwhelming amount of traveling and 24-hour around the clock care that
Yeah.
you're providing, 2 a.m. in a hotel.
Yeah.
You're organizing medicine on the road constantly for 4 to 6 teams in a season.
Sure.
Uh, and I was not the supervisor.
Okay.
I was just a lowly assistant because it was my first job.
Sure. Sure.
And it was very difficult to do things the way I felt was the right way,
Okay.
which is relationships first.
Yeah. So you know what
And
you're dealing with,
so,
right? For the most part, like trying to create
right.
that relationship with the athletes. So, I coached at a Division 1 level, and I was so excited to coach at a Division 1 level. Um, but like I saw the like we were fortunate enough that we had a trainer assigned to our sport, and I'm fairly certain it was the only one assigned. But the amount of work that was put in, above and beyond, like I thought coaching was very difficult because, people think you just show up and coach, but there's all this planning ahead of time, right? It's the same thing.
Right.
And then you're dealing with medicine, and then you're dealing with, young adults on top of it, especially at the collegiate level.
Yeah.
So I would imagine that wouldn't be difficult. So describe for me what you remember to be like a road trip, like kind of like walk me through what that looks like for you.
So at the collegiate level, the most ideal story I can come up with is a trip to Rochester, Minnesota for the women's basketball Final Four. What an honor. Right.
Amazing. Yeah,
Right.
no big deal. It's all good.
Just the opportunity to be able to go and serve my team and represent our university, and great group of girls. So we get into the hotel, and everything in Rochester, Minnesota is connected by skywalks, because
Okay.
it's so stinking cold.
Okay.
Our men's team went to Hawaii that year for the Final Four. We were in Rochester, Minnesota. I think I drew the short straw, but we everything's connected by these skywalks because you don't go outside. And we are like 2 buildings away from the arena where the teams are playing. And we had just traveled all night out of a tiny airport in Harrisburg. So they sent this flight out at like 5 a.m. for us, but we had to be ready and everything had to be packed. So you're just exhausted. My very first trip on an airplane, by the way. And we land in Rochester, Minnesota, and the coach decides that we're going to see the first game because it's the Sweet 16 first.
Sure.
And we're going to go see a game so we can see who we're going to play.
Mm-hmm.
The rule is the entire team has to be together the entire time.
Mm-hmm. Yeah.
So we can't split up. I don't need to prep for who we're going to play. The rule is the entire team has to stay together.
And you're part of the
So we
team.
go
Always concluded as part of the team, right? That I mean, that's the
always
rule.
included.
Mm-hmm.
That's the
Yep.
rule,
Yep.
which is a really challenging and valuable part of being an athletic trainer, is
Sure.
always being included on the team.
Well,
So
sure, because you're
we
traveling
go
with them. You're like, you know what I mean. You're eating with them essentially, but like you're by yourself, but you're with the team, and it's like, so you're like in it, but you're not at the same time, and you're always processing like the next steps, really, right?
exactly. And in the
Okay.
collegiate setting, the athletic trainer does not have autonomy over injuries.
Mm-hmm.
So job security is at risk.
Sure. Sure.
So as we're there, I get a banging on my hotel room door at 4 a.m. We had not slept because we had been out all day. And it's one of my players who her eyes are bloodshot and she swears she has pink eye.
Oh, geez.
She comes into my room. I take a
Touches
history. I
everything.
check
No,
her
I'm just
out.
kidding.
Yeah,
Yeah.
yeah. Take a history and take a look at her. And I tell her, I do not think you have pink eye. Go back to bed. We'll follow up in the morning.
Mm-hmm.
First thing in the morning, she gets up, goes downstairs, and tells our NCAA team representative
Oh, geez.
that she has pink eye and needs a clinic.
Oh, geez.
So the representative calls the head coach. The head coach calls me. She's irate. This young lady's in the starting five. Fast forward 2 hours later, we are in the Mayo Clinic. This is the only clinic we can get into on that short notice.
Oh, my.
But because she had reported it to an NCAA representative,
Correct.
no one on our team was allowed to go to the arena to prepare for the day. So I had not pink eye validated by a Mayo Clinic physician who recommended that young lady not spend so much time in the hotel pool.
Oh, man.
Yeah.
So basically you were right.
Yes. And
Yes.
the coach was still angry with me.
Of course.
And
Because
uh,
you couldn't get, because the player thought she was right and overstepped you and
exactly.
went up the chain. And yeah. So how often does that happen in everyday life for you? How often does Dr. Google trump your recommendation?
52 times a day, I would say. And sometimes it's not always Dr. Google. Sometimes it's Dr. Coach. Sometimes it's Dr. Mom. Sometimes it's, my travel coach. And it can be my personal trainer.
So why do you think that happens, honestly, Aaron? Because it blows my mind only because like so my experience level is a little bit different. Most of it, PT, whatever, but also around the fact that I played, I coached, and worked as an athletic trainer, as an intern athletic trainer. So I saw and was like, my mind was blown with the amount of defense mechanisms that you have to mentally have in place for yourself, to because you're questioned all day and there's pressure everywhere. Even in high school, we're not even talking college. Like, I get NCAA tournament and like high pressure. You're talking everyday high
Sure,
school stuff, right? Like, hey, I sprained my
sure.
ankle. Okay, I don't want you to break your ankle, so I think you should get taped. And then they like go and like, whatever, do whatever they want, kind of thing.
I can agree with them and be questioned.
Mm-hmm.
I don't think you should be taped. I think you need a high quality brace.
Mm-hmm. Mm-hmm.
And in addition to that brace, you need to follow this therapeutic exercise plan
Mm-hmm.
for the next 3 to 4 weeks.
Mm-hmm.
And
Yeah.
I've had kids bring a note in from patient first, must be taped every day.
Mm-hmm.
Doesn't make any reference to therapeutic exercises, physical therapy, wearing a quality brace. Uh,
Stability
and
challenges, just kind of. Yeah.
exactly.
Yeah.
And
So.
that's the most challenging piece, I think, in that regard is sometimes the old-fashioned medicine in my field
Mm-hmm.
is it plays against us. People want quick.
Yeah, of
Tape
course.
is quick.
Yeah.
And you're going to put this Band-Aid on and I'm going to get out to practice and we're done here.
Mm-hmm.
And they don't want to learn about their body. They don't
No,
want to
just
learn
get
how
it
to make
done.
this never happen again.
Right.
Right.
Yeah.
Uh,
Just
how,
get it done. Get me
how
out
many
there.
times?
I've been there. I was that person.
Yeah.
I didn't
Yeah.
care for my trainer. I didn't care for my
Right.
trainer because she was like, "Oh, you have to come in for treatment." I don't want to come in for a treat, like starting third baseman, whatever. I'm like, I'm fine. It'll be fine. And now on the other side, I'm like, oh God, that's like so awful because all you
Right.
want to do is help,
Right.
right?
Right. And that's one of the reasons I think this position in adolescent sports medicine meets my needs is because I like showing them or proving to them,
Hmm.
not so much that I'm right,
Yeah, for
but
sure.
this is the right way.
Yeah.
Right.
And then like we've shared a few cases like ACL
Yeah.
cases, and the most rewarding ones, for me anyway, are the ones that were so challenged in the beginning, but when you see that like light turn on in their eyes, or they're
Right.
like more mature, or you see them a few years later, because we've been in practice the same amount of time, you see them as like a grown up and they're like, you know what, I get it. Like, you helped me understand how to take care of myself. Like, those are the most rewarding conversations. I would imagine for you, especially in high school, that's like huge.
I have now been in my current district long enough that I'm getting
Mhm.
my second set, so a second generation.
Oh gosh, I'm so sorry. That's
Eh,
like, it's wonderful and
It's
awful
wonderful
all at
in
the
a lot of
same
ways. Yeah.
time. Yes, I know.
Well, the most wonderful part is last year I had a freshman, played freshman football, sustained a concussion in an away game.
Mm.
And the dad is badgering our freshman football coach. Yeah, I need Miss C's phone number.
Mhm.
I need to call her. I know my kid got a concussion and I want to talk to her about it.
Mhm.
And the coach doesn't know this dad
Okay,
and that
got
he's
it.
a former student
Sure, sure, sure.
and refuses to give him my phone number, which is okay by me. And but the dad shows up in the parking lot and he is so frustrated and so upset.
Mhm.
And he runs through the concussion diagnosis and he's correct.
Oh, that's
And he's
awesome.
like, I remember when you taught me this.
Uh-huh.
And I remember when I lied to you about my concussion and
That's
I
awesome.
want better for my kid.
That's great.
And
That's so
so,
cool,
yeah,
honestly, to be able to see
yeah.
that like full circle. Like, so
Right.
in the schools, right? In your school,
Mhm,
um
mhm,
on a regular basis, what does
mhm.
your like day look like? So, head athletic trainer at a how many students are in your school, about, give or take?
We serve about 1,400 students 7
Okay.
through 12.
Okay.
So,
Yeah. So not only do you have 9 through 12, you have the middle school also that you're responsible for.
mhm,
So, give me some things like what are the highlights, and not like highlights things you love to do, but highlights like
right,
things you have to do that aren't driving a
right,
golf cart around just hanging out in the sun because
right.
that's what we get a whole lot,
So
you know?
when you see an athletic trainer sitting in the sun and enjoying a really good soccer game or a lacrosse game or a baseball game, which is nice and slow, uh, they are that duck above water.
Hmm.
And
Yes. Love
you
that.
can't see the feet. You don't see the emergency action plan that's been written. You don't see the hour and a half of treatment and game prep for 600 athletes that takes place from 2:30 to 4 o'clock. So when you get to that part, we're working on bringing our heart rate down.
Well, right,
That's
because
the
like
I like
what time do the students get out? 2-ish?
so the kids in my district get out at 2:30.
Okay.
Yeah.
So I would imagine from 2:30 to 4.
Mhm.
If I can describe this and tell me if I get this right. So you imagine someone pulls a fire alarm somewhere in a
Yep.
building, and everyone comes flooding out of every room in the building, and they all are funneling into one room, which would be the athletic training room. Now I have watched at 2:30 when that bell rings or whatever time it is like boom, 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 boom. So it's almost like bracing for this ridiculous storm of people. And you have a team of how many?
Two. There's two of us that serve the
So,
district.
so you have two people serving
Mhm.
in upwards of 100 kids easily, 200
Yeah.
kids, 300 kids per season.
Yeah.
And we won't even talk about the fall season because I know the fall season is like hell
We
season,
serve about
really.
500-600 kids per season. And in that hour and a half time frame, we see anywhere from 30 to 60 kids.
Okay. So if you ask me to see 30 to 60 kids in an hour and a half, and this is where one of our mutual friends, Mr. Patterson, used to bust my chops about being a PT.
Yeah.
Oh, it must be nice to have scheduled appointment times to see.
Right.
You have no appointment times. They're just coming in and you're
Yeah.
triaging,
Mhm.
triaging, triaging, right? Who needs treatment? Who
Yeah.
needs tape? Who needs ice? Who needs to be stretched well? Are you
Mhm.
cleared? Like you're responsible for all these
Exactly.
things, right?
Exactly. So the day starts for us about 11:30, 12 o'clock. And that is straight administrative time until the bell rings. I am communicating with doctors, communicating with physical therapists, talking to our school nurse. I have a phenomenal medical home in my district. Uh, working through paperwork, communicating with my colleague to see where we are with certain patients, what
Mhm.
needs to be done that day, what
Mhm.
trouble we're running into.
Sure.
And then, uh, you know, all that time and then documentation,
Bleh.
which, yeah, you said the low
Ah,
lights also,
yes.
and
Yes.
then
Lowlights.
documentation.
Because you're legally
So
required to document every time a
yeah,
kid comes in, right? You have to write a note on
yeah,
that.
that is it. And so,
500
and it goes
kids.
right into our EMR. Right. Right into our EMR. So we do that. And then the bell rings based on the sports schedule of the day. The kids who have away games go first,
Okay.
home games go second,
Mhm.
and the practice crew goes last. And that can make things quite difficult.
Well, especially
Uh,
so the next layer is you have coaches on you that aren't above
mhm,
you because they're not your bosses,
no,
but they are the kids' bosses. So then the kids
right,
are getting like coach wants, coach wants, coach wants, and you have to deal with those personalities as well, right? In your best
yeah,
medically sound mind in a hurried, harried situation.
right,
And this isn't just one day a week. This is 6 days
right.
a week,
Six
right?
days a week.
Like
6 days a week,
yeah.
right? Yeah.
Yeah.
And
I have
it's
anxiety just
wild.
thinking about it sitting here, to be honest with you. Like,
Uh,
whew, that's big stuff.
the great thing, though, Andrea, is if you put the time into the relationships,
Mhm.
the coaches don't ask questions.
Mhm.
They, what do you think? What do you need me to do?
Yep. I
And you're good to go. But it's definitely investment on the front end.
Sure.
And you know,
Well,
we
you
get
have
coach
so much street
turnover.
cred now, right? Like you have so much street cred
Yeah.
because you've been there a long time, and you know
Right.
you've had to prove yourself. I'm sure, like we all do, really, is results driven. So
Right.
you know, and coaches will respect that because you get it, and you're not like a jerk
And
about it.
almost rightfully so. You know, we have to get a we get a few new coaches every year. And if they don't know me, they're like, whatever, this is what I think. I did this in college. I'm an athlete. I know X, Y, and Z better than you do. And they do. I am not an expert in any sport. And I respect that about them. And it's not until you go through something together that they're like, oh crap.
S-
I had a young lady with a stress fracture in her femur. And the coach
s-
thought I was being awfully dramatic.
Yep.
And lo and behold, she came back with
That's what
affirmative
That's
diagnosis.
what people don't understand. Yeah, that's what like I feel like a lot of people, I don't want to say people in general, but a lot of people don't
Mhm.
understand. Take football cuz football's the probably the most aggressive. Is it the most dangerous in your opinion? You think out of all the sports? It's a tough one, I know.
It is it I'm gonna say yes.
Okay.
Football's
Yeah.
the only sport we've ever landed a helicopter for.
Okay. That
So
that
I'm gonna
so
say yes.
So to go from taping ankles, right, administrative work
Yeah.
to literally life and death situations at any given time, your training is a mix of physical therapy on the rehab side, administrative, organizational planning for sure, relationship building, and then that frontline first responders that you run point, right?
Right.
Basically, you run point if there's any trauma. That's your role.
Absolutely. We do practice sessions with our local EMS crew.
Okay.
They
Yeah.
come in, we practice equipment removable. We take a tour of campus. We've had a lot of construction on our campus this year. We talk about access points. We draw color-coded maps that we put in every ambulance that serves our school district so that if I say there's an injury on field 11, they pull their little map out and they're like, okay, I need to take the blue route
Right.
into campus. Uh, So
Because
there's a lot of beforehand and then in the moment of.
yeah, I mean, and in the moment of, I've seen a few scary ones, and it's gave me much less confidence as far as I control the environment I'm in. You don't
Right.
really, right? So if you're on the road or you're at a game, you can't control the elements of the weather. You can't control the crowd elements of trying to get through people or get your medical team through people,
Right.
right?
Right.
So on top of that, as you're going, I imagine you've done a lot of work around staying calm in tough
Yeah.
situations.
Yeah, it is that has gotten actually a little bit more difficult recuperating afterward,
Okay.
I
Like
think.
your recovery of like coming
Yeah,
down, you mean after? Yeah,
yeah.
so let's take we'll say football for instance, okay? So
Mhm,
football contact happens.
mhm,
What I learned working the sidelines, and I'm not the one responsible, just I get to hang out and learn.
yeah,
But you look for like the legs to make sure everybody's getting up essentially.
mhm.
And so what's the first thing that comes to mind when you have like a man down and they're not moving? Like what's your deal?
The the very my first goal when I get on the field, and I've noticed as I get older, I'm a little slower getting on the field. The
But you're
very first thing I
smarter.
do, right? Well, that's true.
It is true.
Uh, it is true. There are times I used to bolt out onto the field anytime it was more than a second
Sure.
for an athlete to get up off the ground. But now I can watch their body movements. I see what's going on. Moment I step onto the field, they have to come out. So I'm very careful about not wasting
Mindful.
that.
Yeah, yeah, I'm sure.
Right.
Yeah.
Yeah. And that builds a relationship with your coach
Mhm.
because that throws off his game plan.
Sure.
If he has to substitute in and out and in game time situations, that can be difficult. So I, make sure they're moving and you have to know their numbers because when they're down on the field, you don't always know them. And the moment I get to them, I just say their name and I say, I'm right here. Tell me what's wrong. And then if I can get into their face and make that eye contact, and then
You
you go
know,
from there.
right?
Yeah,
Like if it's bad when you see them.
Yeah, yeah. I
And then
had a
you're
young man with a compound fracture tib fib with a dislocation.
oof.
And I saw on the field, you could see it was angulated.
Mhm.
And as I get onto the field, I got to his head first based on how he was positioned.
Mhm.
And he grabbed my hands and said, Miss C, this is bad. Will you pray with me?
Aw.
And the other athletic trainer got there and started to splint him. So I didn't
Right.
do physical care. I just tried
Right.
to do that mental, emotional.
Yeah.
But going on and what
It's
you're looking at most of the time.
Well, because you're managing, right? So you're managing player expectations because no athlete wants to go down hurt, and then they're scared because the
Right.
first thing is they're like, "Crap, I'm out," and then the fear of how bad am I hurt? Like, how bad is it? Type thing. So keeping them calm, directing the the ambulance crew and whatnot, and making those decisions like to send them out. Um, it's a big deal, and it happens in like this itty bitty time frame.
Right. And I got to tell you, Andrea, the
Like I get to read
part
charts,
that,
Erin. I get to read
yeah.
charts. I get to read scripts, and I mean, not always
Um,
scripts because we do some like direct access, but that
right.
like it could be he's going to have a limp for like if you don't splint it the
Right.
right way, if you
Right
don't
way. Hmm.
recognize it the right way, memory delay on concussions, like extenuating circumstances after the fact, if it's not handled appropriately right away. So that's a lot of pressure.
Yeah. You can make something that's not surgical surgical
Yes, by doing
if
bad
you make a
stuff
mistake.
or
Right.
being
If you make a
stupid.
mistake.
I mean, to
Right.
be frank.
And then there's the flip side of it. I mean, our population is adolescent. They're not always familiar with pain. They don't always know the difference between discomfort and pain. They may never have had a serious injury. They don't have the emotional bandwidth to react whatever's deemed appropriately. And so that makes it even more challenging. So you get onto a field and a kid may be screaming bloody murder, and everything that we do is in front of a crowd. So can you imagine 400 people standing around in your clinic
Mhm.
watching you
I
provide care for someone and doing play by play? Like, I can't believe that she's getting him up. I can't believe they're taking the shoe off. Oh, she should never be doing that. I can't believe she's moving. Like all of those judgments. And
Sure.
sometimes they yell them at you.
Sure. No, for sure. Like, what are you
Yeah.
doing? I've seen it. No, I've seen it. And
Yeah.
so, what that says to me is you have to be so confident and so comfortable in your skill set to step into that knowingly, willingly, and shut it out, really. So, like, my treatment time has always been my competitive edge time. Like that's how I transferred
Right.
like being an athlete into patient care. Pre-game is prepping for the cases, game time is when the patient shows up and you bring your best self to it. It's the
Right.
same situation for you, and like finding that zone, really.
Yeah.
Like, you talk about getting in the zone as an athlete, you have to get in the zone as a healthcare provider in those situations to do your best work.
100%. And I often, just like when you watch film after a game,
Yeah.
I will often run through what could I have done differently there?
Yes.
What should I have had with me? What will I do next time? How would I phrase that differently to the patient or to the coach or to the
Hmm.
parents? to create an environment of understanding or coping,
So
in
I
that
mean, and
regard.
then the next level on admin stuff too, like on field thing happens, you send them out, you split them, send them out, all the things. Communicate with the doctor, communicate with the parents. God forbid the parents aren't there. That's probably one of the most challenging, right, things that you have to do
Absolutely.
is make that
In
call.
several situations, you go through 6 emergency contacts. And uniquely, we serve a military district. So I've had patients where their parents have been deployed. I had a softball player who was designated to stay with her neighbor who was their guardian, but the neighbor had just moved and didn't really know the young lady very well, but agreed because she was thought she was doing the right thing, and she didn't really think she was going to have to be a guardian. And this young lady had memory loss, wasn't able to drive, couldn't get to doctor's appointments.
Sure, sure.
So,
That's tough. It's
yeah.
I've seen so many scenarios where you really do well, you personally I know well, and you go above and beyond what most do, which is, one of my favorite standout qualities about you, and I think that's why we get along so well in
You.
the in when we talk about our kid, not our like personal kids, but like our kids, like our athletes that we take care of, we call them our kids. Um and it's you definitely like exemplify that in all the communications, and even like going to tournaments and watching like how you work and communicate, like you really do treat your kids like your kids. And that's why I find it so offensive when people are like, oh, athletic trainer, whatever, you just tape ankles and hang out. And I'm just like, oh my God, like you have no idea. It is I believe, truthfully, it is the most underrepresented and unsung hero. Not enough like glory comes unless the glory only comes when something really, really bad happens,
That
like in
happened.
the
Right.
NFL, right?
Right. With
And
Damar Hamlin. Yeah.
yes, and that's like you're built for that. Like that's just what you
Right.
do. And that's what the trainer was like, that's just what we do.
I don't need any kind of fame. I will live the rest of my life
Mhm.
flying under the radar because of that. There is just no need for me to seek adrenaline.
Sure.
I
No.
think early in my career, I was excited
Yeah.
for adrenaline, and
Yeah.
I had a field hockey player that degloved her finger
Oh God.
in a game, and I was like, "Yeah, that was we talking about it over dinner." And now I see a young lady that also plays the saxophone and has lost a whole year of her music career, and her parents who have to miss a week of work, and somebody has to feed her. I don't need that anymore.
Yeah. No,
It will
well,
be fun.
it changes
Mm,
because, as you mature too, and you like you
yeah,
see things, and I've
have your
seen
own
that in
children.
my, yeah, for sure. And like I've seen in my career
Hmm.
too, you get you don't want to say like get not jaded, that's not the right word, desensitized maybe a little bit with the experiences, because you're like, oh yeah,
Right.
my elbow hurts. Okay, it's elbow tendonitis. These are the things we need to do, and you know what needs to be done. That I would imagine is mostly challenging. Excuse me.
Yes. And the additional challenge, I think, is watching a young person struggle and resist.
Yeah.
It feels so big to them. I can't hold my bat. I can't throw a
Yeah.
ball,
Oh yeah.
and so overwhelming. And they don't want to do anything that you want to tell them to do, but they also can't manage this inability to not be able to do anything.
Right. Right.
So trying to
This is
coax them into action because this might be that first big challenge
yeah.
that they've ever had.
It's that player maturity, and you guys are on the front line
Yeah.
of dealing with that for sure. I give you so much props. I'm so like grateful to know you as a person, but your school should be amazingly happy to have you for their kids. You and your assistant, the work that you guys do is pretty awesome. So, um, thank you.
Well, thank you. I have to say, Andrew, that we don't do it all. And there are parents who will say, I just want my kids to do their rehab here with you.
Mhm.
And I
Mhm.
try to explain to them, I cannot give your son the one-on-one time that they deserve.
Mhm.
They need someone with more experience in this situation and someone who gives them the type of care they deserve. So if I didn't have you
Aw.
to send my kids to, and it's very difficult to send these young people
Sure.
to someone you know is not going to care for them. So to have someone available that you know is going to meet your standards, listen to their histories and their experience because the patient is such a valid stakeholder,
Mhm.
and then get them back to where they want to be is overwhelming. And because someone like you is so unique, not all
Aw.
athletic trainers have that.
Oh my gosh. You like I appreciate that very much, and I think the standards is what binds us, I think, together. Like you know,
Absolutely.
we expect a little more from, not to be too cheesy, but we expect a little more
Yes.
from what
Yeah.
you're providing. You expect more for yourself, and you want to provide that to your kids, and I feel the same. So it's so on the same side, on our side, like my team side, it's so much fun to be able to say, hey, they're at this stage, I think they're good to go. I'm kicking them back to school. Tell me what you think, kind of thing. As opposed to, it doesn't need to be territorial. And that's something that I witnessed a lot. Is that the PTs feel like they're in charge. My perspective is a little bit different. I think the athletic trainers are in charge because you're responsible for their safe return into work. We're in charge when they're in our clinic, but they're overall, it's really just collaboration, I think, is the best way to go.
100%. You can't have ego
No, no
when
ego,
you're
amigo.
in this
Yeah.
field.
No. Well, you
So,
can, but it's not going to get you that far. And I don't think it's going to get the reputation that you want. And, you know, it's working with like minded people makes it so much easier and so much more fun. So thank you for
yes,
coming on and
yes.
talking to us.
Thank you. This time flies. That was so fun.
Yes. And so tell anybody if they have questions for you around athletic training or interested in athletic training, what's the
Absolutely.
best way they can get in touch with you?
You can follow me on Twitter, NBC Missy ATC,
Awesome.
and you can email me directly,
Okay.
eCearfoss@yahoo.com.
Awesome. And we'll drop those in the comments and on the close screen. So Miss C, you're the best. Thanks so much.
Thank you
And
so much. Thank
uh
you.
for everybody
Such a good
else,
time.
yes, no, totally. For everybody else, we will catch you next time. Have a great day.